welcome to the second annual edition of the Wellbeing Cities Forum, taking place entirely virtually over the coming 3 days. I'm your host, Greg Lindsay, the Director of Research here at New Cities, and I'll be the one here to guide you through our sessions in the coming days. We have a very exciting program to share with you: panels, interactive workshops, keynote conversations, and opportunities to network on our virtual platform. Head over to the event's FAQ page for any questions you might have. Before we begin, I would like to acknowledge that I'm joining you today from unceded indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of the lands and waters in which I am joining this gathering today. I would encourage all of you to go to Native Land Canada, which is native-land.ca, to learn more about the territory that you are tuning in from. As urbanists, we believe it's important to learn about the history of our places, which of course our practice is deeply entwined with. Now, over the next 3 days, we're offering translation for every session. So to do that, I would encourage you to use the Zoom app. You need to have it downloaded on your computer, but there's a button in the lower right on the bottom column bar saying interpretation. If you click it, you'll be able to choose the language in which you'd like to listen. All sessions will have French and English, and our announcement of the Wellbeing Cities Award winners and following panel will also be provided in Spanish later this morning, Eastern Time. We're very excited to be working in partnership this year with Novo Nordisk, the City of Montreal, and with the support of the Government of Quebec on making this event come to life. Now, to kick off the day and the event, it's my pleasure to introduce opening remarks from our chairman, John Rossant, Chairman of New Cities and CEO of Commotion Global. John, welcome.
Merci, Greg. Merci. Mesdames et messieurs, bonjour. Good morning, ladies and gentlemen. Thank you very, very much for being with us today virtually from wherever you are in the world. New Cities was founded in 2010 as an international nonprofit institution committed to shaping a better urban future. We work with a global network of policymakers, urban experts, and thought leaders from across sectors, from across industries, from around the world. And we provide them with a platform to address the most pressing urban issues. It's my great pleasure to welcome you to the Wellbeing Cities Forum. This is the second edition of our flagship event and the annual gathering of our global community of urban well-being. The forum ordinarily takes place in Montreal, which is, you can see the beautiful city behind Greg. But it's our host city, of course, and it's the hometown of New Cities. Due to the pandemic, however, of course, we had to think outside the box, and we decided to hold this forum virtually. As the world continues to urbanize, and as this really pretty exceptionally challenging year 2020 has demonstrated, cities are facing challenges, enormous challenges of public health, of economic development, social inequality, and environmental degradation. The COVID-19 pandemic has dramatically underscored the need to reflect on issues of health and well-being, the need to reflect on the way we think about cities, the way we plan cities, the way we inhabit cities. It's also given us pause to evaluate the results of urban planning on the health and well-being of urban residents everywhere. Also, as cities everywhere, in every continent, prepare their COVID-19 recovery plans, urban leaders need to take an active role by placing well-being at the heart of their policy and planning. We believe it's more important than ever to share best practices and inspire each other, and that is what we aim to do at the Wellbeing Cities Forum and program. For this reason, we believe that the forum has a particularly important role to play in today's context. This belief is reinforced by the fact that so many of you are listening to this from around the world, from hundreds of cities, quite literally around the world. Participants from more than 80 countries will be joining us over the next few days. They come from all sectors, corporate leaders, policymakers, urban innovators, academics, representatives from think tanks, and civil society organizations. Throughout this 3-day gathering, We will be inviting you to discover, celebrate, and meet the laureates of the Wellbeing Cities Award, attend interactive sessions, exchange with each other, debates and panel discussions, hear from the most innovative and impactful projects being developed and implemented, and work closely with urban innovators from around the world at workshops and meetups. Our experts and guests will be weighing in on issues such as civic engagement, housing for health, climate migration, resilience in cities, urban biodiversity, so important, smart cities, equitable mobility futures, and more. I do look forward to interacting with all of you in the coming days, in the different sessions, chat rooms, which is how we network in 2020, and hope that you will build lasting relationships based on the conversations that you have there. In closing, I want to thank all of those who have made this gathering possible. First off, a very, very special thanks to our partner and our friends at Novo Nordisk. It's been an honor and a pleasure collaborating with you on this great initiative. We are very grateful for the continuous support of the City of Montreal and of Mayor Valérie Plante, our partners since we launched the Wellbeing Cities Forum and Award in 2018. Je souhaite également remercier le gouvernement de Québec ainsi que le ministère des Affaires municipales et de l'Habitation pour le soutien financier. We sincerely hope to be able to all gather in Montreal next year for our 2021 edition of the forum. Our new cities members who are here participating with us today, I would also like to thank the Toyota Mobility Foundation, Jacobs, the McKinsey Global Institute, Canada Mortgage and Housing Corporation, Midland States Bank, Smart Columbus, Geodesign Hub, Secure Access, and Urban Leap. And finally, the representatives, of course, of some of our finalist cities. I'm so happy to see you here and glad that you'll be sharing with us your inspiring work on urban well-being. Buenos Aires, Bordeaux, Cape Town, Curitiba, New York City, Philadelphia, Tirana. Later today, of course, we will be hosting the Wellbeing Cities Awards ceremony, and we will reveal this year's laureates. We're very, very excited about that and to be sharing that with you. I now invite you to stay tuned, stay here for the first edition of the event, the opening plenary on measuring urban well-being. And I wish you 3 days of inspiring and engaging conversations. Once again, thank you and merci.
Thank you so much, John. It's now my pleasure to introduce our opening plenary session, Measuring Urban Wellbeing. We'll be joined momentarily here on the Zoom stage by Niels Lund, Vice President of Health Advocacy at Novo Nordisk, Joan Clos, the former Director of UN Habitat and Mayor of Barcelona, Fernando Straface, Secretary General and Head of Foreign Affairs for the City of Buenos Aires, and our moderator, the Canadian Broadcasting Corporation's Debra Arbec.
Well, good morning, and thank you so much. It is my pleasure to be your moderator for the next hour for this opening plenary, Measuring Urban Wellbeing Cities Forum 2020. I would have absolutely loved to have hosted you all here in Montreal once again this year, but alas, COVID-19 has had other plans for us. So we will be doing this virtually, and it will be wonderful just the same. We have a wonderful panel to introduce to you now. We'd like to introduce, first of all, Niels Lund. He is the Vice President for Global Prevention and Health Promotion in Novo Nordisk, a global healthcare company with more than 90 years of innovation and leadership in diabetes care. He is also engaged in the partnership with UNICEF to reduce childhood obesity. Joan Clos is the former executive director of the United Nations Human Settlements Program, UN Habitat, at the level of Undersecretary General by the United Nations General Assembly. Dr. Clos specialized in public health and epidemiology and served 2 terms as mayor of Barcelona. Fernando Straface is the Secretary General and Foreign Affairs for Buenos Aires. He is one of the founders and former executive director of CPEC, the top think tank in Argentina and widely recognized in Latin America. His areas of expertise include good governance, public sector reform, and civil society. Good morning to you all. Bon matin de Montréal.
Good morning.
Okay, I want to start off with this new global normal that we're all undergoing right now. It certainly dealt a huge blow to major cities around the world. Streets are near empty. Shoppers are flocking from retail to online like never before. Telemarketing has left office towers in downtown cores barren. Once public transit that was bustling and crowded with riders now has to adhere to strict public health guidelines for all users to stay safe. So I'd like to start off today by looking ahead past COVID-19. I'm going to go around to each of you on this. Post-pandemic, will we see cities founder or will we see cities flourish? And I'd like you to choose one and then explain what our city's most urgent challenges are. So Niels Lund, I'll start with you. Founder or flourish, and what are the most urgent challenges right now?
Thank you, Debra, and good afternoon here from Copenhagen. I would have loved to have been in Montreal like some of you, but good to see so many people from around the world. Back in March, I was quite pessimistic. I'm becoming more optimistic and would then choose flourish. However, I mean, there's some way back. I think the pandemic has highlighted the potential for strong leadership, both in and outside the health sector, in cities, of nations and global institutions. So leadership matters. Unfortunately, we've also seen the negative impact of poor leadership. So leadership matters, and also in cities here, that's, I think, is an important lesson. For many cities, the collateral damage of COVID-19 will probably be bigger than the virus itself and the cost for the health system. And the economic pressure will increase and persist for many years to come, particularly in low and middle income countries. I think that the cities will remain centers for growth and innovation, as they have been, and I think they will continue to do that. But there's also a flip side to this positive story of growing prosperity. We know that slightly more than half of the world's population live in cities. I think it's like 54%, but already now 2/3 of people with diabetes live in cities. And this development is fueled by the way that we live and our sedentary lifestyles, but also the growing inequality that we see in our societies. We might be worried about the impact of COVID-19 now, but we should also start worrying about the long-term effects of the rising tide of obesity and diabetes and what COVID-19 has done to the trajectory of this tide. Since 2000, diabetes prevalence has doubled and will continue to grow so that 1 in 8 will have diabetes by 2045. And this is not just a Western world phenomenon. 3 out of 4 people with diabetes live in low and middle income countries. So this is a global problem. And the challenge is that to bend the curve on diabetes over the next couple of decades, we need to reduce obesity by 25%. That sounds almost impossible. But if we do so, we will realize the Sustainable Development Goals of reducing premature mortality from chronic disease by 1/3 in 2030, and will also impact the goal on ending all forms of malnutrition. OECD estimated in October last year that the pull on the economy from obesity is 3 to 6 percentage points on gross domestic product. And then you add to this the impact of diabetes also on productivity, then you are probably in the ballpark or even beyond the economic impact of COVID-19, just on a permanent basis. To address this challenge, we, together with University College London and the Steno Diabetes Center and many other partners, we launched the Cities Change Diabetes program 6 years ago, a network of now 27 cities and more than 100 local partners, municipalities, private sector, academia, civil society, and so on to change diabetes in cities. Here we drive research and action in urban diabetes, vulnerability, and community engagement. And that's actually where my optimism comes. I see true leadership in these cities and other cities willing to engage in finding solutions to what can, you know, after COVID-19 can have a significant impact on societies. Thank you.
Thank you very much, Niels Lund. I'll continue with the rest of our panelists. Do you see post-pandemic cities foundering or flourishing, and what are the urgent challenges facing cities right now? I'll move next to Fernando Straface.
Thanks, Debra, and thanks to the New Cities for the invitation and the prestigious panel that I'm sharing. I'll go for the flourishing, definitely. I've been all these last couple of months very optimistic, not only because of the vitality of the city at the present, but also because of the lessons from history. This is not the first time in history that big cities are impacted by a black swan of different features. You remember the yellow fever in the 1700s. Cities came back with a lot of urban transformation that made them better to live and better for the quality of life in cities. Or the cholera crisis in Europe and in Buenos Aires at the end of the 18th century. That cholera crisis was the reason for one of the most important sewer system, the centralization of waste collection, and some other urban transformations that made the cities better to live in. Or I was watching the other day a video on how these other health challenges transform the way education buildings were built in Europe a couple of 100 years ago. So this is not the first time that cities are under stress, and so far cities have been resilient to that stress. Cities are still the best unit for congregating talent, innovation, diversity. I cannot think of any other organizational arrangement better than cities to conglomerate all that competitive advantages. So the short answer to your question is yes, cities will come back. We will probably come back different in terms of urban design and trends, but they will maintain the vitality and the vibrancy that brought them here.
Thank you so much. I'd like to move on to Joan Clos and put the question to you, founder or flourish?
I am sorry to say that I am also agreeing on the flourish side. And this is a pity because then we are not going to have an argument. And then the audience would be a little bit, bored. But yes, of course, they're going to survive the cities. And this is because there are, apart from the pandemic, there are other factors that contribute to the relevance of the urbanization in the process of the modern life. We have reached 7.7 billion people in planet alive, and there's no other way that to have so many people living in the planet other than having a good share of them living in urban areas, because it's more efficient, it's more economic, it consumes less resources. There's no way that in the planet could be something like 7 billion people, all spread around. It would be no natural spaces. The natural resources would be totally, destroyed, etc. Then the reasons, the cities are here to stay, but that doesn't mean that we are not going to have huge and new problems to address. And probably the most important problems, they are not health problems, although now we are very impacted by the pandemic. But I see that the challenges for urbanization in the forthcoming decades or century, it's going to be more in the software design of the cities, the political side of the cities. Cities now are becoming the place where the new poverty is concentrating. During the history of humanity, we have had a history where poverty was a rural issue and the city was prosperity. But now we see that the worse off, now they are concentrating in the cities, not in the rural areas. And this is changing the politics of urbanization. And I think that this is as important as the pandemic, as the questions of how cities will survive this moment. As Fernando has said, we have passed in our human history through many pandemics, much worse than the current one, and the urbanization was never stopped. Remember the plague in Europe and other big challenges. In fact, it was the contrary. The plague was a factor that increased the productivity of the rural areas in the Middle Ages. And in fact, it was a boost to the well-being of the population. Then history is very dramatic and is very, it's very sad in some aspects. Then no, the question, this kind of fatalist predictions about the future of urbanization related to COVID, there's not going to happen. It's just the contrary. I think that if something is going to happen is that probably urbanization will accelerate its pace because people will need more support, and the way for the state to provide support and to finance the support is through increased efficiency of the resources. And it's very clear that the efficiency of the resources is better managed in the urban areas. Therefore, I see things like that. That will present new challenges in mobility, in social coherence, in equality, and also in ways and means to prevent social uprising, because perhaps we can risk new social uprisings like we had in the Arab Spring just in 2011. Then I am much more interested on the political evolution, social evolution, even the psychological evolution of urbanization, that in the physical aspects of urbanization that I see that they are very well established, and it's a very efficient institution that humanity has built up.
I want to pick up on a point that you just brought up when we look back to past pandemics, and maybe I'll bring Niels Lund into this now, because I want to talk about how you say that this pandemic could be an opportunity in terms of moving forward in different ways, using more creativity and urgency in moving forward for our cities. Could you just perhaps get into a little more specifics on that?
Yeah. That in modern society, I mean now, in the beginning of the 21st century, the affluent societies, they are a very complex institution, very complex build up. There's a social, political, economic, artifact that it has its own system of homeostasis, of self-equilibrium, and therefore it's very difficult to change things, to change the status quo. When you want to change the status quo, and if you have been in politics, you will agree with that, it's very difficult because immediately you find trillion reasons to don't do it. But as the Chinese say, never lose the opportunity of a good crisis. If there's a way to change something, is through a big crisis, because in big crisis there's the opportunity to join wills together in order to do some change. If everything is like everything and things don't go well and more or less everybody, makes its way and, live the everyday life, etc., it's extremely difficult now to do a change in social models. But with crisis, then it's easier to foresee new, look at the climate change. We've been talking of climate change since the Club of Rome established its first report. Then came Rio 81 or 82, I don't remember. We've been 25 years talking, 30, 40 years talking about climate change. And there's still no agreement on how to deal with it. When science, by the way, they state that, of course, this is very clear. For example, I was in for my past job, I was in New York during the Sandy tempest, and I was in a hotel, and that day, that the light went off and the metro was flooded, is the first time that I saw the Americans worried about climate change. It was not the speeches, it was not the international treaties, it was the experience of the real immediate challenge. Unfortunately, New York is not all the United States. It seems that most of the United States doesn't follow the lesson, but the Sandy tempest was a good lesson. And if there are 2 or 3 more of that, you will see how the public opinion about climate change will move quite often. Then I'd
just like to bring Niels Lund in on this, because you have sort of shifted to climate change, and I do have a question about that. Niels Lund, how has the pandemic affected cities' commitment to climate change? All we talk about right now is COVID-19 and just getting through this crisis. In your mind, are we going to reach the goals that many cities have put in place for the future? Has commitment changed?
I'm actually, when it comes to climate change, I'm actually very optimistic that it will be cities who will be driving the change to a large extent. And I think, for example, the work that the C40 climate mayors are doing is exemplary. We actually worked with them for quite some years in mapping the co-benefits of investments in climate and the impact on health and vice versa. And there is a good case, bicycling and walking, good examples of where you both get a climate and a health benefit. But I think also more, and that's probably been further, clarified by the current crisis, is that the populations in cities most at risk of COVID-19 are also the ones that are most at risk of climate change. They happen to live in those areas that are most deprived. So there's a health inequality or health inequity lens that we must use to put a spotlight on the challenges and address those root causes. Because as Dr. Clos mentioned, we see growing inequalities in cities right now. And I think we need to combine the the efforts of the climate movement, as well as the health systems to probably, and also the city, healthy city planning to address all of those issues. Let's go back to January, or maybe just late 2019. If I asked you to rank the 10 best health systems in the world from your point of view, I think you, and then I put that list up against the health systems, how they've fared during COVID-19. I think there will be, complete misalignment. I think what we thought were the strongest health systems have not proven not to be so. And I see particularly in health systems that are fragmented or even disorganized, that community organizations actually filled that void. And I think, that's both in the health area, but it's also in the climate area, that when you can't count on somebody to help you out, and if there's no system or welfare state to pick you up, there is still a certain, at least if they know each other, community resilience, community organizations that will build resilience in those communities and actually be a force for change. We've seen that in the network that we are part of, and I think also when you look at other cities around the world, and some of the examples from the laureates and this the ones who submitted to this award, I think there are also some fantastic examples there.
Fernando Straface, I'd like to bring you in now. What is your take on climate change? Is the pandemic producing an opportunity to move forward to attain our goals? Or are we taking a step backwards just because our focus has been so committed to finding a vaccine for the pandemic and just making our way through this crisis?
In order to answer that question, I'll start following one of the lines that Joan brought to the table. The pandemic, in a way, confronted cities and societies with a kind of a collective sense of life. In a way, it reminded us that we are here in this planet living together, and there are certain points where we need to collaborate with each other, otherwise we will disappear. I don't want to sound so drastic, but that's the basic argument behind how to find the pandemic. Climate action is another collective cause that was already present before the pandemic, but can be probably the next big challenge for societies around the world. And in order to tackle that and to approach that, I think the pandemic also reminded us how important it is not only to have a society organized, but also to have effective governments. The attributes of good government with the pandemic, I think, highlighted and redefined themselves. First, you need a government that bases its decisions on data, on evidence, that is able to communicate that evidence to the public. You need a government, as Niels was referring, that is able to provide good public goods, especially health, but also some other public goods that were in crisis during the pandemic, for example, education. You need an educational system that is resilient to the type of challenge that COVID presented. You need a government, especially at the city level, that is going to take into account quality of life in cities and how the public space is prepared for that quality of life. We were all sent to the public space during the pandemic, and cities differ in the quality of the public space. So public life became more important, as important as what happened in your private life inside your apartment. And that's why some of the urban transformations that are happening and accelerating thanks to the crisis that Joan was referring, are trying to gain space for the people. The concepts of 15-minute cities, cities at human scale, all of them are trying to recover the city for the people, get back the city to the people. And the quality of the government is going to be measured in those terms. How much the government is securing quality of life in the public domain, including the quality of public goods. And I like to finish this entrance referring to kind of a new geopolitical role for cities. Cities have, especially big cities, metropolitan areas, have been, if you want, the unwanted characters of the pandemic because of density, because of communication, because of interconnection to the world, which is one of the great attributes, actually, of global cities. They were already very important in the geopolitical agenda because some of the big issues were already happening at the cities: climate change, social integration, immigration, and they were already being very important because is it at the cities where the opportunities are happening, where the people want to go. So in the next times, I think cities are going to increase their geopolitical role. It's going to be much more important for mayors to be international actors. It's going to be very important, the dialogue between mayors and presidents, mayors and international institutions, and you have certain networks and institutional arrangements already in place for make that happening. But I think the cities are going to, in a way, be the laboratories for the new leadership that this pandemic made very important.
Thank you. Dr. Clos, I'd like to ask you about this, just in terms of leadership in cities, and then moving forward, how important is the sharing of information internationally among leadership, among cities around the world, as we move out of this pandemic phase and into trying to rebuild our cities? How important is it for cities and leaders of cities to share information and learn from each other?
It's more and more important. I think that when during the 20th century, the past century, all the debate about urbanization was mainly a social and political debate, but not based in facts and figures. If you look at the theorists of urbanization of the 20th century, let's say Jean Jacobs, Murdoch, or Lefebvre, all the popes of urbanization, they were talking about urbanization. Our masters, they were talking about urbanization from a socio-political point of view. But now I think in the 21st century, we need to add facts and figures, because, you know, if not, it's very easy to talk about cities and urbanization. Everybody can talk about the city. In fact, everybody talks about the city. Poets, artists, anthropologists, economists, sociologists, you know, everybody can be a master of what a city is or what a city should be. And the issue here is that not very often we share information. For example, we are talking about climate change. I've been in this field of urbanization since 45 years. I don't know if you know that there's still no agreement between cities to share the same metrics when we talk about you know, how to measure contamination or whatever. If you look at what we do, every mayor has the most green city of the world. When I was mayor of Barcelona, I can assure you that Barcelona was the greener city in the world. Bloomberg was when he was mayor of New York, he said that New York was the most greener city of the, then of course, and then we can invent, and in fact, we do invent hundreds of scales of measurements in such a way that everyone can be the number one in a good scale. The question is to find out the good scale that it puts your city in the front line. Montreal can be, of course, the number one of cities, but then Vancouver will be also, and take care of Toronto, that also there's going to be the number one. And this is something which is real, because in urbanism, at the end, we talk about politics, because the city government, they are elected politically, and that should go on being like that, because urbanization is a political activity. But to make the effort to accept a kind of common measurement system, it's very hard. It's extremely hard. And in fact, we were doing the Sustainable Development Goals, and we also established a panel to establish the metrics, etc. And you know, we have been talking there month and month and month in trying to agree on which variables. We are not agreed yet in the scale. We are only fighting on which values are we going to accept, because nobody wants to be compared, especially if there's no certainty that you are going to be in a good place. Then therefore, we need to overpass this phase of urbanization. We need to bring more hard data to urbanization. In the United Nations, we can only use the official figures that every nation gives to the system of the United Nations. Then we cannot invent our own figures. And therefore, we only, officially, we can report only the official figures. But now we have something new, which was not there in most of the last century, is satellite photography. You know, nobody controls, well, except the ones that do have satellites. Then there's a beginning of a new methodology that can introduce some kind of objective comparison standard, no? But even on health, and it's good that Niels is representing the health sector. Even in health, there's no agreed way of measuring comparatively who is doing better, no? We can talk about life expectancy or etc. Everybody, for example, measures unemployment in a different fashion or in a different form. Then we are always managing scarce information. And there are places where these things are even worse, more difficult. For example, if you want to have serious hard data about Latin American cities, well, you will need to do a lot of surveys and a lot of studies, because you know, there's a lot of people is afraid of being compared. Then I think that in the 21st century, we are going to see an advancement of the facts and figures on urbanization, but it's going to be very tough politically, because it's a difficult topic.
I'd like to pick up on something that you just mentioned and bring Niels Lund in, because you are an expert in the health field. And during this pandemic, we have seen the health sector and communities working, public health and especially, and communities working together like really we haven't seen in decades, in certainly decades that I've been on the planet. And I'm wondering, can this relationship be nurtured to collaborate on tackling tackling health issues in cities and well-being challenges as we move forward out of the pandemic, Niels Lund?
Yes, is the short answer. The slightly longer answer is that I think it's important to distinguish between measuring and understanding. Because I think, as Dr. Clos talked about, we measure a lot of things and they're difficult to compare. But the gateway to finding effective solutions is to understand what motivates people for the different behavior. The example from the city of Houston that we have worked very closely with is that what drives risk of diabetes and obesity are the classical ones. It's age, it's low income, it's certain levels of health inequality. But we also found that topics like trust or mistrust, isolation, and also time poverty were factors that were driving this. And this was a new finding for the city of Houston. We're saying that we need to rethink our public health interventions here, because we've missed out on, for example, the group of people who have health insurance, who have jobs, but have 2 hours of commute to and from work every day, so they don't have time to buy healthy foods, they cannot cook, and they don't have time to deliver a good meal to their children there. So by understanding what is slightly below the biomedical domain, but understanding what are the cultural barriers and also some of the social barriers, I think we will find solutions to this. That is difficult because it will sometimes challenge our conventional wisdom or thinking about what should be done and what can be done. But I think that though in understanding people's behavior, that's actually where we will find the really good solutions, and maybe also thinking outside of the box.
Fernando Straface, we have seen cities trying to adapt to the pandemic, adapting in many different ways. I'd like to get your take on Buenos Aires. How is Buenos Aires doing in terms of taking on the challenges that have come up during the pandemic?
Thanks, Debra. First, I mentioned that during the pandemic, and we are still fighting it or dealing with, we've been very international in the way that our mayor chose to exchange ideas, finding a new solution, testing possible measures. And I like to remark that because I think that the level of cooperation that occurred among cities during the pandemic was exceptionally positive. And I think it especially highlights in the context of less cooperation among countries. I think the type of dialogue that mayors of the world have on what works and or what didn't is something to highlight, because that in a way projects a future in which mayors, as I was saying before, are going to be at the center of global dialogue of certain issues. In the case of Buenos Aires, we tried from the very beginning to signal into the rest of the world that we were going to process this pandemic with a high level of evidence-based type of decisions, with a very high level of coordination between the city government and the federal government. And I have to mention that we have the will for doing that of the federal government, which is of another political party than the mayor. Then it was very important from the very beginning to think society in the city as part of the solution and not part of the problem. We will present measures to the people under the assumption that we can trust people to adjust or to commit to those measures, especially the measures of social distancing and the different protocols for the different activities. And This, I think, is a big definition comparing to some other approaches in which society is part of a problem and the role of the government is to over-restrict what society can do or not. Then, in terms of urban transformations, as Joan was saying, we took advantage of the dynamic to accelerate some of the reforms that were already in place, especially those related to promoting a more human scale type of cities. We increased the bike dedicated lines. We almost doubled the bike dedicated lines during this period. We increased the pedestrian areas of the city. We promoted a lot what we call the polycentric type of cities, bringing activities, opportunities, incentives to different places in the geography of the city, so the city can grow more balanced in different places, and you don't have to commute 1 hour from the place where you live to the place where you work. And then again, I like to mention the international orientation of the city. Before the pandemic, being a global city was kind of a big attribute for a city. And it also was probably one of the main reasons why the global cities suffer the most the pandemic, because of their connectivity, of course. But we think Buenos Aires has to emerge of this crisis equally international as it was before. Because we think the pandemic also brought a competition for what we call and some people call the digital nomads of the world, that are going to choose where to work based on quality of life. So we want to project those attributes for quality of life in Buenos Aires to those people, and to attract them to live in Buenos Aires, securing for them not only basic needs or public goods that the government provides, but also an environment of diversity, connectivity, and vibrancy as it was before the pandemic. That's a kind of a general vision with which Buenos Aires is approaching these difficult times, but with a lot of hope for the future.
Niels Lund, I wonder if you could pick up on this. Is there something that you would like to highlight in terms of attributes where a city, perhaps your own city, was particularly successful during the pandemic?
Me?
Yes.
Okay. I am not in government now in the city. Then I am retired. Therefore, I am not accountable of what is going on in Barcelona. I think that the COVID also shows some of the weaknesses of the international health system. Not just that the WHO has probably not been at the level that we were used in the past, when it was able to eradicate the smallpox or was able to eradicate the polio, and now there's more fight. The United States government has been menacing the WHO of retiring the funds. All these kind of things doesn't help. And therefore, when you look at a system of comparison of the pandemic, you can easily be lost in translation, because the systems of graphics that the press and and the press conference of the ministers they show, they are quite confusing. Because if you have a kind of superficial overview, you will say that Well, which is the country in the world that is worse off? Can we agree on that? No. Which is the country which is better off? Can we agree on that? No. How is, how can we compare France with Spain and Italy? It's not very clear. What happens in Ecuador and Peru? What is going on in Brazil? You know, it's very difficult to be assertive in this, because there's different methodology, different. I am an epidemiologist by training, and at the end, I only trust one indicator, the over-excess mortality. Is the only thing that I read every day. Because hopefully we are not assisting at two epidemics at once. Therefore, most of the over-excess of mortality must be attributed to the COVID. And when we look at the over mortality, we see very different, information, which, by the way, doesn't mean that the health system of the country is doing badly necessarily, because there are still reasons by high mortality that we don't understand of this virus. For example, in Madrid, we have the double of mortality than in Barcelona. And there's no scientific explanation why this is happening, because the health system is the same. And therefore, there must be other causes other than the quality of the health system, which affects the pandemic. But the governments...
I'm so sorry, I have to cut you off because
sorry, no problem.
I'm so sorry, but we're starting to run out of time. We're down to our last couple of minutes. So I am just going to go around to each one of you just to wrap up. Dr. Clos, I'll give you 30 seconds or so if you could just give us your final thoughts moving forward.
I think that urbanization, it's going to flourish as in the past, and we need to take advantage of this crisis in order to do the very needed reforms in many sectors of the local governance and in the relation with the central government and regional government in order to improve the quality of urbanization.
Dr. Clos, thank you so much. I'd like to go back to Niels Lund now and get your final thoughts for the day, please.
I see great promise in community interventions and community forces. I think there's an unexplored source of innovation and also resilience in our communities. And it's actually something that both will carry us through this health crisis, but also the coming climate crisis.
And Fernando Straface, your final thoughts for the day.
Okay, I will say that there's never been such a supply and demand of expert knowledge going on in the debate of public issues. I think we should put an orientation of all that knowledge to the well-being and quality of life in cities, thinking internationally, thinking collectively, and thinking evidence-based.
I want to thank all three of you, Fernando Straface, Dr. Joan Clos, and Niels Lund, for joining us today. What an interesting, fascinating, and optimistic look ahead to the future post-pandemic, post-COVID-19. I hope to see you in some fashion here in Montreal, whether it's with Wellbeing or just visiting our fine city. But thank you so much for your insights today. Again, a very interesting conversation that could definitely have gone on much longer. Yeah. The best to all of you.
Thank you, Debra.
Thank you.
Thank you, gentlemen.
Thank you. Take care.
Thank you all so much. I'm Greg Lindsay returning here. I want to thank you all. For the audience members, if you want to learn more about how cities can impact the health of their residents, check out our partner Novo Nordisk's Cities Changing Diabetes program. We've linked the report and some information at the bottom of the session page online. We're now going to take a very short break, 10 minutes, so that you can check your email, refresh your coffee, basically sort of check out for a second, but be back in 10 minutes sharp at 11:30 for the announcement of the 2020 Wellbeing Cities Award laureates, as well as a panel from the chosen award winners. We'll be back in just a moment.